Hello, everyone. Thanks very much for your patience. We had a very long floor debate on some important bills today. We have delayed HGO bill hearings until 1:45, so we have about 40 minutes. See what we can get in today. I will mention this again, but for those of you who are here, we will reschedule the sign language interpreters bill 260. We will reschedule 596 health and human services transportation improvement, and we will also not be discussing HB 646 state procurement today. So let's see how many members of the subcommittee we have. As soon as we get a quorum, we'll go ahead and get started. Aaron, I think we're just going to start with you. And 274.
Yeah. And then we talked about just tabling the transportation bill. Since we were just
596.
Yeah.
Yeah.
In the interest of time.
Yep.
And we'll just put it on next meeting.
We'll just put it on the next one. Okay.
Did the sound disappear?
I believe your mic's on.
Have we started?
Aaron, for a work session, do we need a quorum or can we just get started? There are 5 members present.
You should have a quorum.
Okay. So we need one more?
Yeah. We can make calls if you're having.
The
Looks
good
like
ones are here.
Yeah.
The good ones are here.
Just out of curiosity, Mr. Chairman, am I getting a virtual lunch? Is that what I didn't understand? how I'm
Yeah,
getting this-
virtual lunch. It should be on your desk right now. It should be here by the time we get to committee in the next half hour.
Yeah, I got mine, Delegate Chisholm. Didn't you get yours?
Yeah, it's delicious.
Yeah.
The shrimp salad was very thankful, Ken. Thank you very
Yeah.
much. I mean, very nice. Thank you very much.
My actual lunch is delicious.
All right.
You want us to make some calls?
All right. Delegate Austin is on.
Okay. Then we're good.
Okay, and I see that we're already streaming live. Okay, good afternoon. This is the Government Operations and Health Facilities Subcommittee of the Health and Government Operations Committee. We are starting a little late today. Thank you, those of you who hung on waiting for us. We really do appreciate your persistence and your patience. Aaron, let's begin with House Bill 274.
This is the task force on reducing emergency department wait times that was discussed last week. There has been a reprint that incorporates amendments that are being offered by Delegate Kerr that were distributed via email this morning. The amendments increase the size of the membership of the task force from 7 to 21 members. There'll be 2 legislators, 4 state agencies, 2 patient representatives, 3 hospitals, 6 ER staff, 1 behavioral health provider, 1 EMS provider, and a representative of the nursing home industry. And there'll also be a specialty psychiatric hospital. So I don't know if you want to take the composition and discuss that.
Yes, so that the amendments have been explained. And I see we have MedChi on, and we also have MHA on. Either Aaron or Dana, do you want to speak to this bill?
I can speak on behalf of MedChi and the Maryland, the emergency physicians. I think that the composition addresses the groups that had asked to participate during the hearing on the bill. And I think it does also include those that impact the ED. As we have said before, that the issues really don't start with the ED, it's the surrounding issues. So we think that it has a nice balance to ensure that we have all voices being heard.
Thank you. Aaron?
Sure. Excuse me. Thank you, Mr. Chairman. Where Dana spoke to the composition, I'll speak to the charge. I think that, what's very important is looking at those root causes and the drivers of some of the ED throughput issues. I think that these amendments will nicely drive towards finding solutions to this issue. I also wanted to give the committee an update. MHA had been working internally to develop a plan for the hospitals to work towards a collaborative to look at some of the internal ED issues that we could pursue some best practices and work together as a field. And last night, our executive board approved that collaborative. So we will be starting that in May. So MHA will be launching a hospital field-wide collaborative in May, which will work in tandem with this task force should it move forward. Thank you.
Thank you. Anyone else here to speak to House Bill 274?
The Delegate Kerr, I just had gone over the composition. There's kind of 2 more pieces.
Oh,
if you want me to.
Anything else?
So MIMS has agreed to staff. I know as introduced, it was MDH. They did not want to staff. They just didn't feel like they were the appropriate entity. And MIMS has agreed to staff. So that is incorporated in the amendments. And then the charge, as introduced, the charge was very broad. It was to identify potential solutions to reduce excessive wait times. So these amendments kind of make the charge much more specific. The task force would identify root causes of wait times in emergency departments. They would provide an analysis of healthcare workforce supply and unmet need, an analysis of changes in acuity over time in hospitalizations and emergency department visits, and the availability of post-hospitalization care options and barriers to accessing those options in certain states. The task force would also coordinate with other state commissions that are examining issues related to workforce shortage and behavioral health capacity, review studies and recommendations on addressing workforce capacity issues, and conduct an analysis of reimbursement policies and the effect of those policies on hospital reimbursements. The bill as introduced required the task force to make recommendations, and the amendments clarify that those recommendations would include legislative, regulatory, or other policy initiative.
Anyone here to speak to that amendment? Ann Palmisano.
Thank you. Well, I appreciate all the hard work and collaboration that's gone into this particular version. I mean, I have two concerns. One, it's a very large group. And as we know, the larger a group you have, the harder it is to reach consensus. But that's, something everybody already knows. And it actually broadened the goal quite considerably, because it was originally focused on making comparisons with other states in 3 specific areas. So it's a much broader purview. And I'm wondering what the time frame for reporting out would be. Thank you.
Aaron, does the bill specify a time frame?
Yeah, this has to be done in 1 year.
Delegate Chisholm?
Thank you. I have a question on the amendment, because I'm looking at the makeup or the composition of it. And I see that we have 1 registered nurse employee in the emergency department from member of the employee organization, which makes sense. But then below, a 1 service employee employed in the emergency department who is a member of an employee organization. Can you tell me what that is? Is it just somebody that's not a medical professional?
These would be like the frontline workers that do the intake for patients, and would have some insight as to bottlenecks that occur either before or after they're part of the ED process.
Okay, thank you.
Delegate Kipke.
I know we can't do it as an amendment, but if I could put an amendment to make Anna Palmisano not only be the consumer advocate on the group, attend every single minute of every single meeting without any absences. But since we can't do that in an amendment, maybe we could make a recommendation as a committee.
Okay.
I'll just throw that out there for another time. Thank you.
Without objection, so ordered.
Could it be an uncodified language?
Yeah.
Can't do that.
Delegate Hill.
Thank you, Mr. Chair. I just wanted to get clarity, and I don't think this is I don't think it's a very large group. But I did want to get some clarity if we go back to the composition. We're having down here after line 20, we have in 5, 4 representatives who are emergency department personnel, 2 are licensed physicians, and 2 are licensed nurses. Then we have down in 9, a registered nurse employed in the emergency department. Can they be the same person, or is there a reason we have the nurses specified in 5 and then we specify another nurse?
I think
Aaron, go ahead.
I mean, it was overlap because these are one would be a union representative.
Right. So the question is there a problem with saying when we say 2 are licensed nurse, can we say they're one of whom must be a union representative, or at least one of whom must be a union representative? Or is it the purpose to have 3 nurses represented and those other 2 may or may not be? I'm just trying to understand.
Yeah, the way it's written, you'd have 3 nurses. One would be
At least one would be a union.
Yeah.
There's nothing to
so
stop the other
it's
2
your
from being,
call
right?
as a committee, how you feel. But the way it's written now, 3 nurses, 1 is from a union.
Right. So I was just asking for, as this amendment was drawn up, was that deliberate or is just the way it's read?
As of now, it's deliberate.
Okay. And the pediatric. So again, 4 representatives from the emergency department. We had something about the pediatric, I'm sorry.
Yeah, the hospital with a pediatric emergency department.
Right, but it doesn't specify that the representative has to be someone who works in the pediatric. So it
Yeah,
could be
correct.
anybody who's at a hospital.
Yes,
If they happen to have a pediatric department.
correct.
And I guess it's really a question for the chair, or for if Delegate Bandari is here. Is there no particular emphasis on making sure that someone in the pediatric emergency room department is on here to express their particular point of view? It's fine that the administration send, or that they send some representative of a hospital, but that happens to have a pediatric emergency room, but the representative doesn't have any relationship with that.
Aaron, Dorian, can you respond to that?
Yeah, Delegate Hill, that wasn't the intent. I mean, the intent is running a pediatric emergency department is completely different than running an adult emergency department. It requires different staffing, it requires different expertise, it requires different layouts, different, you decorate them differently. Like everything top to bottom is completely different. So the idea wasn't a slip around to get another hospital in there. Running a pediatric emergency department, building it, staffing it, getting kids in and out is completely different than an adult ED. So, that was why we separated out the pediatric emergency department, and not every hospital has those capabilities.
Right. So are you saying that it wasn't that you felt it needed to be representative by someone who works there? You just want to be sure that one of the hospitals represented happens to have one. It's not, you don't think it's important for the commission that the perspective of someone who actually works in the pediatric emergency room be there, just that a hospital who administratively runs one have representation?
Well, I don't necessarily think that I'm saying that. It's going to be up to, we're going to have to put forward nominations, and the governor will have to decide, who is appointed. But I think it's important that we have someone thinking about how these things are, how a pediatric emergency department functions inside a hospital.
So I guess the question, Aaron, is this the wording, now that I've raised these questions about how the nursing is worded, how the pediatric emergency room department is worded, are you still saying that this is the language you want to stick with, or do you want to tweak this a little bit, or have us tweak it to try and make sure that it actually reflects the diversity that it seems like you're trying to achieve, or you want it to stay vague where there can be redundancy and particular people can be excluded? That's really the question.
So I don't think anybody is, I think that this is pretty broad representation here, what we have. I think, we do have 3 nurses. If you see almost every other group, it's 2. I think that, on the nursing side, I'm not sure it is really relevant whether they are part of a bargaining unit or not. But that was, the will of the body. So that's, that's fine. That's okay. I think that that's a good, that's is what it is. But I think, I think that this is a good representation, and especially we need people around the table who can bring expertise in running and in providing direct patient care and in moving patients through an emergency department, either through discharge to home or to their next level of care, whether that is in an inpatient unit or to another facility, or to some other kind, to a nursing home. You notice we added a post-acute representative. So I think that that is an important piece of it.
All right, thank you. Thank you, Mr. Chair.
Delegate Kaiser.
Thank you, Mr. Chair. I'd like to follow up on that because what I heard Delegate Hill mentioning and asking was actually never answered. And so what I thought you were trying to ask Delegate Hill was if we're going to include a pediatric ER, that we should actually make the person on the task force actually from the pediatric ER. So
That is correct. And that
so-
the answer
so-
was no.
And so I guess I would, obviously I don't want to hold up this bill, but I don't know what it would take to amend it that way. But I think that's what you're asking, and I would want that as well. If we're trying to get the understanding of the pediatric ER, why wouldn't we get a personnel from there, whether it's frontline or nurse tech or doctor, is almost beside the point, but someone from the pediatric ER department itself. So
What if, can I make a suggestion?
Yes,
'Cause
please.
this kind of goes along with Delegate Kipke's suggestion. You're looking at specifics. If the bill passes, the committee could perhaps write a letter to the governor's appointments office saying this is what we'd like to see. And just
couldn't we
adopt-
just amend it though? Couldn't we just
Yeah,
fix the
what's
amendment?
problem? Right.
No, no,
I kind of
it
agree
was
with
just a
Delegate Kaiser.
suggestion.
I'm sorry, Aaron. Yeah.
And I can work on amendments and bring it back.
I would prefer that. I mean, he can only work from the people who are nominated. And if there's no requirement that the nominee includes someone who works in a pediatric emergency room, then they're not going to be on there for him to choose from. So we can send all the letters we want.
Okay, so we just have to think about then maybe something like the representatives represent the types of hospitals, or you match the staff to the provider somehow. Then that'll just take me a little bit of time. Unless you're only specifically concerned about staff representation from the hospital with the pediatric emergency room.
I again, not trying to hold things up. I just think that this first run at amending it to include these people could be tweaked a little bit. And to the extent, you're good at this stuff and that's fine. I'm happy to help if you want, but I suspect you know that's not necessary. But that's all. I just think that saying, well, this is the intent, even though it's not what it says, let's just leave it. We're not at the end of session. We're not even right up
That's
against
fine.
the
It
crossover.
was just a thought. I just think it needs to be thought through. So who do you add? Do you just take one of the nurses off and then?
I don't think it has to be done right.
That's what I'm saying. Do you need to do it right now? Or we can bring it back on Monday?
Yeah, we're going to meet on Monday at 1 o'clock. We can bring it back then if there's still some questions.
And I'll work on something between now and then to get one representative from a hospital with a pediatric emergency department. That seems to be the main concern.
Delegate Shaleka?
Thank you. I don't know if I'm working off the right reprint, but I have a reprint in front of me from yesterday at 4:51. And on line 20, it says one representative of a hospital with a pediatric emergency department. Does that get it what you want? It's in
So the point is to have a staff who works in the department. And I think what the bill contemplates would be the actual hospital.
Okay, so
So
beyond just one with a okay. All right. Thank you.
You're welcome. Aaron Dorian?
Thank you. And I think I did answer the question poorly, but what I will say is what we contemplate is that we need to, like the individuals that you heard from at the hearing, those 3 doctors, they happen to be doctors, but at this point, they are administrators. They are leading either the emergency department or they are hospital administrators that think every day about hospital throughput, that think about hospital boarding, that think about how to run the entirety of the hospital. With these amendments, we have a number of frontline workers, including the 2 nurses, the 3 nurses, the 2 emergency room physicians, the direct the service worker. You know, we have a lot of direct workers. What we feel we need with the hospital representation are those folks that are thinking about administering the hospital. So the 3 representatives would be hospital administrators. The pediatric hospital representative would think about how they administer that pediatric emergency department. It could be the head of the pediatric emergency department, you know, at Johns Hopkins University, at Johns Hopkins Hospital. So I think, you know, adding another, you know, direct, I'm not sure that we would get at what we need if we already have representation from direct care providers.
I see. Mr. Chair, if I may.
Yes, really quickly, Delegate Hill.
Yeah, sure. So I think that's the point. Now I get it. And to your point, the other thing that we heard is that the administrators and the hospital, so they've been working on this for a while, and it's often people who are administrators, right? And so I think you're right, that voice is important, but I thought we also heard testimony that it feels like what's been missing from the discussion is the people who are doing it. So administrators have had plenty of opportunity to come up with solutions. So I'm not saying their voices aren't important, but I think the question for the subcommittee is, what is that right balance? And so what you said is you wanted it to be an administrator who might happen to be someone who worked in the ER, might not, but your emphasis was making sure that the hospital administrators of these unique settings are all represented. So that's clear. Thank you.
Okay, we're going to hold this, come back to it on Monday. Thank you, Aaron. Let's go on to HB 429. It's Delegate Charles, Bill, and Lindsay.
This is the bill, excuse me, that adds the comptroller as a member of the Procurement Improvement Council, also known as the PIC, and authorizes the comptroller to send a designee to the PIC if the comptroller is unable to attend a meeting. I circulated amendments on this bill. There are 2 really that were included. One came from the Attorney General's office in testimony, adding the Attorney General to the PIC and authorizes the Attorney General to send a designee if he's unable to attend. The other amendment adds to the PIC scope discussion of strategies to increase the participation of small, minority-owned, and women-owned businesses in procurement contracts. That second amendment was adopted on the Senate cross-file to this bill, which is on 3rd reader now. The first one in the Attorney General was not considered in the Senate, so that is not on the cross-file.
Move the amendments.
Second.
We have a motion and a second to move the amendments. All in favor, say aye.
Aye.
Anyone opposed? Motion on the
Move the
bill is
bill.
amended.
Move the bill
Okay,
as
thank you,
amended.
Delegate Kipke. Thank you, Delegate Hill.
Second.
On the bill as amended, all in favor, say aye.
Aye.
Anyone opposed? Thank you. We're going to talk about HB 586, Delegate Stein's bill. And Lindsay, you again.
This bill requires state agencies that purchase compost, mulch, or other soil amendments to give preference to products produced from municipal solid waste, food waste, sludge, yard waste, clean food waste, or other organic materials under specified conditions. And then the bill defined preference as a percentage price preference and any other provision that favors products produced from organic materials as specified in the bill. I circulated a reprint of the bill incorporating a number of amendments. These were amendments that were suggested both in testimony and then apparently were also offered on the Senate side. And that entire reprint was approved by Delegate Stein. So he supports those amendments. The first one excludes sludge and adds dredged material and construction waste to the list of materials from which the compost, mulch, or soil amendments may be made in order to receive a preference under the bill. This part, to match the Senate bill, it adds aggregates to the bill, and it adds a requirement that the product be readily available in order to receive the preference. And then finally, rather than having the price preference, it requires the Maryland Green Purchasing Committee to establish specifications for compost, mulch, or other soil amendments and aggregates to be used by units in procurements.
Thank you. Understanding we have less than 10 minutes left. Does anyone have anything to say? Delegate Kaiser.
I just have a quick question for, I think that was Lindsay. On the second page of the bill, I think lines 9 through 13, by by taking out that gives preference to, is the preference staying in there? I'm reading it too fast to
Yeah,
get-
so what they're doing instead of having the price preference is there, if you go down to the lines that appear under line 27 on the second page, the Maryland Green Purchasing Committee would instead be establishing specifications for the purchasing of compost, mulch, or other soil amendments or aggregate produced from that list of recycled or organic materials. So that specification would be included in the procurement from the beginning rather than as a preference. So hypothetically, what they could specify is 50% has to be this recycled or organic material.
Can I move the amendments?
So
Second.
thank you. Motion and a second on the amendments. All in favor, say aye.
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 Anyone opposed? On the bill as amended.
Move the bill as amended.
Second,
Second.
on the bill as amended. All in favor, say aye.
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 Anyone opposed? Okay, the bill passes. HB 605, Lindsay.
This bill establishes a commission to establish a memorial to the global war on terror. The commission must provide recommendations for the funding, design, construction, and placement of an appropriate memorial dedicated to Marylanders who fought in the global war on terror and their families. The Department of Veterans Affairs must provide staff for the commission. And this came out during the hearing. The dates on this commission are tied to a commission that was previously established for a women veterans memorial. So you'll see that the dates in the bill take effect on the termination of that prior bill so that the Veterans Affairs doesn't have to staff both of the commissions concurrently. Assuming that that prior bill terminates as expected, then the reporting deadlines in this bill are by February 1st, the commission must submit a preliminary report on its findings and recommendations and a final report October 1st, 2025. There are no amendments on this bill.
Thank you, Lindsay. Anyone to
Move the
speak to
bill.
this bill? Thank you. Bill's been moved. and seconded. All in favor, say aye.
Aye.
Anyone opposed? Thank you. HB 636.
This bill alters the definition, excuse me, of personal information under the Maryland Public Information Act to include an individual's email address. And the bill also makes changes under the Public Information Act that establish when a custodian is prohibited from allowing or authorized to allow the inspection of records related to email addresses and telephone numbers. There are no amendments on this bill.
Move the bill.
Bill's been moved
Second.
and seconded. Any further discussion? Oh, Kathy, Delia Chalega.
Thank you. I just have a quick question. Does this give a commercial entity access to the email and cell phone number? Could a commercial entity? I mean,
In what context? So email address is included in your personal information. So there are instances where email addresses are available for inspection. And so, for instance, let's see, if we look at the provisions relating to notary publics, a custodian would allow inspection of the part of a public record that includes the notary public's business email address. Or if the business email address is not provided, then the notary's personal email address. So in that context, it would be allowed, for instance, but there are other contexts where it specifies, and the same is true for business email addresses of licensees. And then in other contexts, it's specifically denying inspection of personal email addresses. But it just depends on the context.
I just want to make sure that we're not opening up that information through PIAs, that a commercial entity could get that information. Maybe Delegate Gazone, can you give me a little more background on who's going to be able to get this information?
Well, I'm going to defer a little bit to Lindsay, but my understanding is whoever puts in a request through the PIA process, that whoever the custodian of those records is will make a determination about what's okay to share and what's not okay to share. This actually provides more protection that personal emails and personal cell numbers are not shared.
It's more protection, not less.
Yeah.
Because it makes distinctions between the two that were not there, between a personal email, as an example, a personal email and a business email that were not necessarily there before.
Okay, that, yes.
And
Thank
other than
you.
the specific instances that are covered in the bill, anywhere else, it's not specified other than in the definition of personal information, which is generally not accessible, except in the specific information where, like I said, that it is included.
And I'm sorry to be holding up the process, but I do have certain questions regarding this bill. We're talking about students at this point, correct?
There is one part of the bill that refers to a custodian denying inspection of a school district record that includes the telephone number and personal email address of a student.
Yes.
Yeah.
Because I'm seeing that right here, right above 4-331. But oh, sorry, no.
4313. Yep, the bottom of page 2 and on to page 3. So it would be denying the inspection of the personal email address of a student.
So we're having some unintended consequences, as you know, that right now we're having an issue where the certain youth are getting exposed to fentanyl, and we're having several overdoses of children. And because of legislation previously passed, now it doesn't allow the children to cooperate with police, and they don't necessarily need to be speaking with police because we've created legislation to bar them from speaking with police. And so similarly here, I would be concerned that because we're barring these kids from, sharing the information contained within their personal email addresses, we won't be able to detect cyberbullying or any other, ill intent that's taking place, whether it's, maliciously or not, so that we could be able to find corrective action.
Delegate Gazon, is that within the scope of your bill?
Sorry, I don't believe so. No, this is really only about information that's shared in response to a PIA request. And if anything, it's going to shield personal email addresses and cell phone numbers. Am I correct, Lindsay?
It doesn't specify cell phone number. It actually removes the distinction of home telephone number of a student, just because, frankly, a lot of people, myself included, only have a cell phone. We don't have landlines.
Me too.
And then it references a personal email address of a student because many students have school issued email addresses as well, which would be a distinction there. But this is already so this is in the same context in which a custodian would deny inspection of that student's home address, telephone number, biography, family, physiology, religion, academic achievement, the rest of that record. So it's just adding their email address to the rest of that student's personal information.
We're just limiting this under the scope of a PIA.
Yeah.
Yes.
And it's the actual email address. If you're talking about accessing their actual email communications or something like that, that would be, and I don't work in criminal law, but is presumably subject to different requirements if the police are actually trying to access evidence of a crime. That's completely different.
Okay,
they're not working
on
Public Information Act for that.
I'll move favorable.
Okay, Lindsay, you said there are no amendments?
No amendments on this.
Okay, any further discussion on this bill? All in favor, say aye.
Aye.
Anyone opposed? Okay, thank you, everyone. I will see you in committee room. This ends the work session of Government Operations and Health Facilities. Remember, Monday, 1 o'clock, we will reconvene. Thank you.
Thank you.
Thank you.